Good morning, ladies. It's Dr. Kira Lourie, and I'm here with my dear friend and colleague, the rep for a company that I use all the time, anytime anyone has any gut or other health problems. Katherine Sumner is with Microbiome Labs. And Microbiome Labs was the sponsor of my program a couple of years ago. And as far as I'm concerned, they are the premier company to make gut support health. They have enormous amount of research that they put into all of their products. So welcome, Katherine. Thank you for being here.
Thank you. I'm excited to be here.
So let's talk a little bit about the company so people can really get a sense of how wonderful it is.
Yeah, absolutely. So Microbiome Labs is really a research-based company. And what that means is that we are one of the few supplement companies out there that have quite a bit of studies on all of our products before we even launch them to you so that you can share them with your patients. And the two founders, Karan Krishnan, who is a microbiologist, and Dr. Tom Bain, who is actually a practitioner, a chiropractor and functional medicine practitioner who's been in the business for 25, 30 years. They partnered when they found out and discovered the benefits of the bacillus spores. And I'll talk about that, as we continue on. And so we launched our first product in 2012, the Mega Sporebiotic. And since then, we have grown tremendously in the gut health space. We really have become the gut health experts. And now, as of last year, we were acquired by the largest biological company in the world, who's based in Denmark, Novozymes, which means to you as a practitioner, as well as to you guys out there as Dr. Laurie's patients, that we just have that much more access to research and microbes or bacteria that's going to be beneficial to not only, obviously, your microbiome, but also the resiliency of your health.
So important. That was a big conglomeration of joining of two expert forces together to really augment each of the companies. It's going to be really wonderful for the world. So I don't think a lot of people understand the difference in probiotics between, quote, regular and your specific spores. And then I want to go into what are prebiotics and when do we need them? And I know you have a specific total gut health repair, which I recommend all the time. So let's just go through a little bit of all of that to give people a good educational foundation.
Absolutely. I did put together some slides. Could I share those with them? Would that be easy to do?
But
Okay.
Go ahead. I don't know what I need to do on my end. Do I need to share screen here?
Let me see. Let's see. I think it might just let me do it.
I'm tech challenged, everyone. As you know, if you're part of my community, tech is not because I know at the bottom of my thing, it says share and there is.
If you want to stop sharing.
I have no slides. That's what it says.
Okay. So let's see if you guys can see my screen here in just a minute.
Yes. I added your computer to the stream. So we're good. I figured it out.
So can you see Microbiome Labs?
Yeah, we can.
Wonderful. Perfect. I like to do slides just because sometimes I think it makes it
I agree.
More interactive.
Yeah.
Right? So we talked a little bit about the history. This is just a few of the products that we have here at Microbiome Labs. And like I mentioned, we're just continuing to grow. This is just a pyramid showing that most of our patients would possibly start on testing. And then from there, we have long-term products. We have our total gut restoration, which is a short-term protocol, and then some other products that are reinforcement or supportive products. So if you don't mind, Dr. Laura, I'd like to just kind of touch on the leak, what it means to even have dysbiosis or endotoxemia. Your audience may know it as leaky gut, which is kind of a buzzword out there in the world of gut health. And we know now that our guts, our health really is very connected to the health of our microbiome. So chronic conditions like anxiety, depression, digestive issues, diabetes, cancer are just some of the conditions and diseases associated with an imbalanced gut, or trillions of microorganisms that are actually living throughout our digestive tract. So you can see here on this screen, on the left, we have a healthy microbiome, a healthy gut. We're going to have low levels of pathogens and toxins within the microbiome, this strong mucosal barrier really protecting our microbiome from the rest of our body and our systemic portion of our body. And then there's a very thin layer of cells called epithelial cells, where we really want to see tight junctions between these cells so that this whole protection or barrier is really separating our gut from our bloodstream and from the rest of our body. This is what we want to see, right? And a very strong, healthy immune system and a healthy, resilient microbiome. But what happens over time
after cancer treatment, especially chemotherapy, radiation really impacts what you're about to see now, ladies. And it's almost impossible to get through cancer treatment and not have what Katherine is about to share with us.
Right. So yes. So definitely cancer treatment is one of those dysbiosis risk factors, is what we call them. And what happens is when the microbiome starts to create more of an it's more imbalanced, the ecosystem becomes more of an imbalanced environment, then that's really the environment where our toxins, our pathogens can thrive, and they'll start to grow. And as they start to grow, they will start to degrade that nice mucosal barrier that was protecting our microbiome from the rest of our body. They'll start to break down those tight junctions, and then they will start to seep into our bloodstream, which is not what we want to see. And when that happens, now we know that this is called, you can call it endotoxemia or leaky gut. And 1/3 of Americans actually have leaky gut, is what we're finding now. And we also know that leaky gut leads to chronic inflammatory conditions, such as, the list goes on, such as anxiety, such as rheumatoid arthritis. It can be rashes, it can be different skin conditions, autoimmune, diabetes,
depression, anxiety, not to mention, chronic constipation, alternating constipation, and diarrhea.
Yes, absolutely. So these are kind of the overview of different risk factors, which most people, have been exposed to one or two of these different risk factors. So including stress, including lack of sleep, infection, or post-surgery, post-chemo. And what we really want to see in the microbiome is a beautiful garden with a very diverse plant population, or we like to call it, right, our bacterial population of microbes. We want a lot of diversity, and we want to create an environment where those toxins cannot live. Because this is what we're seeing a lot of the time in our patients, is we're starting to see more of a barren environment, less diversity, and more of the pathogens being able to take over the microbiome, causing those chronic conditions. So now that you have an idea of what leaky gut is, I'm sure, probiotics have been kind of a buzzword for quite a while. And if you've ever had, any kind of food poisoning, stomach flu, diarrhea, and taken antibiotics, sometimes you may have been recommended probiotics as well to help to support your microbiome.
Are women?
Very rarely. Now, Dr. Lourie would talk to you about it.
But or a functional medicine or a chiropractor, the probiotics are not recommended as part of standard of care, and that women are given antibiotics quite often as part of their cancer surgical port insertion treatment. And no one has ever said to me, "Oh, and the doctor told me to take probiotics." So this is really
very rare. Yeah. You really need to be working with somebody like you, Dr. Lourie, who's more of a naturopath and in that functional medicine space. And so, but a probiotic, but we see them everywhere, right? They're at Costco, they're at Walgreens. You can buy them at the grocery store, but
Don't
there's a
get me
big
started
difference.
about buying vitamins from Costco and
Yeah.
just please, nobody spend money at Costco on vitamins.
No. And that's what I'm going to explain. So, that's what's really important about understanding who's developing those products, those supplements, what research do they have on those products, and do they have any research at all? Are they testing for toxins within those supplements where you could actually be making yourself, worse and causing more inflammation? So it's really important that working with someone like Dr. Lourie, who knows that information and knows to look for that research, is going to be offering you supplements that are of quality, and are actually going to help heal you. So the difference between probiotics is that the probiotics that you see and that are the most popular ones are going to be lactobacillus or bifidobacterium. Now, with these probiotics, they really can only tolerate room temperature. They cannot tolerate acidic conditions, and they're anaerobe, which means that they have to have oxygen to survive. So if you think about these probiotics going through your gastric system, which is very acidic, it's extreme temperatures. Most of these probiotics are not going to survive to even get into your gut or to your colon and upper intestine to be able to even recondition and do the job that they're supposed to do. Now, most of these probiotics are actually going to be dead as they're going through the system. We call them ghost probiotics, and they do have a certain function, but they're not going to be able to actually get in there and really recondition the gut and really heal the gut like the sporebiotics, because they're dead. But what they will do is, because most of these bacteria have a slime layer on the outside that will do some kind of mechanism of action, but it's a single mechanism of action. So they will either inhibit a specific action within the body, or they will encourage a certain, action in the body. But it's very, very specific. Whereas the sporebiotics actually stay dormant, and some have stayed dormant for centuries. And the reason they can do that is they have an outer exospore layer that you can see on this diagram here on the right that is similar to calcium. So it's a very hard shell that's protecting the spore until they get into an environment where they actually wake up, they come alive, and they use something called quorum sensing. So think of it as like your sixth sense, where they're sensing this environment that they've landed in, and they're sensing that there needs to be some work to be done. And each spore has a different function. And so once they hit that environment, they will start to do their work. Now, what that means to you as a patient is that they have 100% survival rate through the GI tract, in order to even get into the colon and start to recondition by increasing microbial diversity, helping to increase those really health promoting and beneficial bacteria in the gut. And then they'll stay in there and do their job for about 21, 28 days. And then you just excrete it out through your stool. So they really are, I would say, they really shift the paradigm in terms of helping us to really heal our gut and our microbiome, therefore helping to heal, our body systemically as well.
So they stay in your gut for how many days, Amber?
21 to 28 days.
That is amazing. I don't think any other probiotic works that way. I think this sets microbiome products apart, in addition to everything else that they do.
Yeah. And so our Mega Sporebiotic is our sporebiotic, and it includes 5 different spores. And then we have 2 other products that we also recommend with our Total Gut Restoration Program. And it's a total of a 3-month protocol. And I'm going to go into each of these products and why it's so important. But as I go through this, I want you to think about your gut like a garden, right? And so each of these products is going to help you in terms of removing weeds in the garden, which we would refer to as the bad bacteria, the pathogens and the toxins. Then we're going to actually bring in the Mega Pre to really help to fertilize and add in the compost to really feed those beneficial bacteria. And then the last is our Mega Mucosa, which is really helping to bring in a barrier. We talked about that protective barrier between our microbiome and the rest of our body. And that's what the Mega Mucosa is going to do. So that in the end, you have this beautiful microbiome that's similar to that slide that I showed earlier, right? With all the diverse different plants that are really flourishing and working together to help your body overall have a better immune system and also
Katherine,
help with
excuse me,
inflammation.
can you hide that little rectangle thing that's there, because it's cutting off some of the
There we go.
there we go. Thank you.
Yeah, there we go.
Content.
Thank you. Yeah, I get it. I get so excited about sharing this that I didn't even notice that, to be honest. So with our spores, what the spores are doing in the first stage of revitalizing your garden is think about them as removing the weeds. It's starting to remove the weeds, starting to till the soil, and they're starting to fertilize those beneficial bacteria. And so it's 100% spore based. So we have 5 different spores that are within the Mega Sporebiotic. It's only 4 billion CFUs. And I get this question a lot, and even patients might ask this, well, how come, because when you look at probiotics on the shelf, they're like 100
20
billion or 100.
or I mean,
Yes.
I don't even know what those numbers mean, really.
Exactly. And so with the spores, because there's 100% survival during digestion, more of them, more CFUs doesn't necessarily mean better. You don't need as many to do the job that they need to do. There's also no refrigeration needed, so easy to take with you in your travel.
Right.
Which is wonderful. And they're just going to help with, again, helping with diversification, which we know is very tied to the overall health of patients. It's also helping to increase those beneficial strains of bacteria as well.
Now, one of the things I find with this product is it's also very safe to take when a person is on antibiotics.
Yes, it's antibiotic resistant. Absolutely.
So you can take your antibiotic, like at 8 a.m. and then an hour later, you can take your Mega Spore, and, you don't need to worry that taking this Mega Spore is going to impact the antibiotic working, and you'll still be protecting your gut, which I think is very important.
It's extremely important. Yes. Yeah, very important for sure.
And let's talk about how to start taking the Mega Sporebiotic, because you don't there's a very specific way to begin to input this information into your body. It's a little different than other probiotics people may be used to.
Yes. So the Megaspore, because it's so effective, right? And each of the spores have a different function. With all of our products, we recommend starting slowly. So with the Mega Sporebiotic, the full dose is 2 capsules with a meal once a day. But we recommend starting with 1 capsule every other day for 1 week.
Right.
And then the next week, titrating up to 1 capsule every day. And then the third week, going up to that full dosing as long as the patient is tolerating it well. Because think of it this way, if you've ever done a detox, you never want to detox really quickly, or you're going to have negative symptoms. And so because the spores are going in and really creating an environment where the pathogens cannot thrive, that you're going to have some die-off of those bad bacteria, which can cause negative symptoms. So if you do it too quickly, you can imagine that you would start to have some of these symptoms like headaches or rashes or diarrhea. And that's not what we're trying to do. So we really want to go slowly to start to recondition and really start to, create this environment where those pathogens cannot thrive.
Thank you.
Yeah. So the Mega Sporebiotic is really helpful, like I mentioned, in gut reconditioning. It also, because of that, is going to help with allergies, food sensitivities, and inflammatory conditions. So as Dr. Lourie mentioned, obviously very supportive post-chemo. The third product that we incorporate then, and you're going to layer these. So you'll start with the Mega Sporebiotic, slowly adding it in over a month time period. Then the second month, we'll start to add in our prebiotic. Now, some of you may be familiar with prebiotic foods, like asparagus, sauerkraut, fermented foods. Those are prebiotic foods, but they're feeding not only the beneficial bacteria, they're also feeding the harmful bacteria. So we wanted to try to come up with specific functional fibers that is only going to feed the good bacteria, right? So those really beneficial keystone strains that we know are associated with reducing the risk of chronic disease. So that's where our Mega Pre comes in. And it comes in a powder form as well as a capsule form, depending on what the patient's needs are. And it includes these 3 functional fibers, the xylo-oligosaccharides from non-GMO corn, the fructo-oligosaccharides from green and gold kiwi fruit, and the galactosaccharides from cow's milk. So you might ask the question, why these specific functional fibers? It's because in our research, because remember, we're a research first company.
Fantastic. Yeah.
That these were the fibers that increased those specific beneficial keystone strains, those bacteria, at a clinically higher percentage than any of the other fibers that we looked at.
Now, what if somebody is allergic to cow's milk?
Yeah, so this only has the fiber within this product. It does not have the proteins.
Right.
Yeah. So if they have a sensitivity, we always say they should be fine.
I have never had anyone have a problem with this product ever.
No. Yeah. And then this is just research, again, just showing within 4 weeks how we doubled the increase of short chain fatty acids, which are very helpful in terms of inflammation, which Dr. Lourie can share that with you as well. And then how it increased these beneficial strains. Therefore, our research showed that it decreased these inflammatory strains. So the third part, so now that we've gone in, we've pulled the weeds, we've tilled the soil, now we've put in our compost with the Mega Pre, now we're going to build that barrier. We're going to start to build that barrier back up. And that's where our Mega Mucosa comes in for the third month. So the Mega Mucosa is a blend of immunoglobulins, which is actually in breast milk. And that's why, that can be very, very helpful for when we have children, for babies. Immunoglobulins help to bind and neutralize to toxins within our microbiome. So they're very helpful in helping to reduce and calm things down and get those toxins out very safely. We also have a blend of 4 different amino acids, which research shows helps to rebuild that mucosal barrier, that really pretty blue barrier that I showed in the earlier slide. And then there's some citrus polyphenols, just adding in more antioxidant properties. These are the different toxins. You may have heard of H. pylori, Listeria, C. diff.
C. diff is a very common toxin for women to get post chemo and radiation because their gut is so compromised and their immune system is so compromised. And it's very common for women to come down with these infections, which can be pretty serious, not to mention they require massive dosing of antibiotics. So your immune system is weakened and you get one of these infections, and then you further weaken your immune system to treat the infection. So you're in a vicious cycle.
Yeah, absolutely. Yeah. And more reason, to add in the Mega Sporebiotic in this program as well. So this is just the breakdown of what it looks like in terms of the dosing. So we talked about the Mega Sporebiotic, titrating it very slowly, moving up to the 2 capsules daily with a meal. And then the second month, adding in that precision prebiotic, that really fertilizer that's really feeding the good bacteria. And again, you're going to titrate up. So starting with half a scoop or half of the capsules, which is 3 capsules for the first week. And that can be with or without food. And then going up to the full scoop the second week. And then the third month, adding in all 3 products, including the Mega Mucosa, where again, I would recommend starting with half a scoop and then moving up to that 1 scoop. And then the fourth month, you can continue for another month if needed, depending on the symptoms of the patient, or we would usually recommend a maintenance dose, which is going back to, with the Mega Sporebiotic, maybe taking it 2 to 3 times a week, and the Mega Pre and Mega Mucosa just once a week, just for a maintenance dose.
So this is very wonderful. Let's stop sharing that. Go back to our double thing. There we go. Thank you so much. That was great.
Yeah,
Lovely.
great, good. Thank you.
For those of you in my community, I will be sending out an email with all of this information and a link with the discount code to order these products through my Microbiome account that they've generously provided to me so I can pass it on to you. And I just want to really reiterate the quality and the efficacy of microbiome products. I mean, there are so many probiotics out there. And one of the things that I specialize in with the women I work with is I do my own research so that when I recommend something, I can absolutely guarantee that the product has a research department. Their products are third-party tested. If I called up and said, here is this bottle, you know, can you give me the information on it? It's barcoded. So they have all that information. And that is the kind of quality control that you need when you buy something. And you don't find that if you buy it at on the internet necessarily, or at Costco, which drives me crazy, CVS, or Trader Joe's is another one of my favorite places people come in with vitamins. And so you have a serious metabolic disease. So you need real functional supplements. And that's why I'm bringing these experts to talk to you about how we can help you up-level the supplements that you're taking so that you know that what you are taking is actually working. Do you
Absolutely.
want to have other words of wisdom that you'd like to share with us?
Yeah, and I couldn't agree more with that, Dr. Lourie, because I do think, I don't believe most people realize that the testing, you know, and the quality and how important that is, because if it's not from a company that is doing the testing and making sure it's non-GMO, there's no metals or mercury, there's no, you know, other toxicities within that product before bringing it to market, then you're going to make this, you're going to make your, whatever you're going through, you're going to make it worse. So I think that's really, really important. And I think it's also important, especially with this type of program and our products, is to work with someone like a Dr. Lourie who can guide you through the protocol and also, you know, just answer questions. And if other things come up, you're able to then, you know, work with them on that as well. Because otherwise you're just kind of doing it on your own and you don't really have all that information.
Right. Dr. Google only goes so far, right?
Yes, yes. And there's a lot of misinformation, unfortunately. So, yeah.
So
Exactly.
thank you so much, Katherine. And you, those of you in my community, will be receiving an email from me very shortly, maybe over this weekend, with all this information that Katherine so generously shared with you. And thank you for those of you who are here live. I'm thrilled that you're here. And this will be playing on my Facebook page, and it will also go on my YouTube channel probably by early next week. So Katherine, thank you so much for being here with the community. And ladies, have a nice day. This is Kira Lourie signing off for now, and there'll be more later. Bye for now.
Thank you.